Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. General rules, and this is of the ossification. So first is the primary ossification sector is single. It is single, and next comes the exceptions. So exceptions, it includes the carpal bone and also the carpal bones it ossifies out of birth. Next is the clavicle. The clavicle has two primary ossification centers. The next point being the secondary. There is ossification, the secondary ossification. The second ossification centers can be single or it can be multiple as well. So it can be single, multiple, and it appears after the birth. So what are the exceptions here? The exceptions is that it includes the secondary center for the lower end of the femur. It appears before birth. The secondary center for the lower end of femur. So this appears before the birth, and the epiphysis of the upper end of the tibia. Epiphysis of what? Epiphysis of the upper end of the tibia. It may appear before the birth or in some individuals. So it is before birth in some individuals. Next is the secondary centers, and this is of ossification, which appear first or last to unite. Which appear first, they are last to the unite. So what are the exceptions here? The exceptions, it includes the lower end of the fibula as well as the secondary center at the lower end of the fibula. It appears during the first year. So it appears during the first year and before upper end, which appears in the third or the fourth year. But it fuses between the 15th to 17th year. Before the upper end fuses between the 17th and the 19th year. Before the upper end, it fuses between the 17th and the 19th year. Now we look at the secondary ossification centers. It fuses together. The secondary ossification centers. So it fuses together. It fuses together to form a single epiphysis, and which then fuses to form diaphysis. Then forms the diaphysis. So secondary ossification center fuse together to form the single epiphysis and then fuses to form the diaphysis. So exceptions here, it includes the upper end of the femur. Then the three secondary centers at the upper end of femur, it includes the head, that is in the first year, greater trochanteric. So the head at the first year. Then comes the greater trochanteric. And the fourth year, the lesser trochanteric, and 12th year. Now they fuse independently with the shaft. Now lastly, the direction of the nutrient artery is in the opposite direction to the opposite. So what is opposite? The direction of the nutrient artery is opposite to the direction of the growing end of the bone. To learn and grow daily like this, please do subscribe.